Hello everyone, and welcome to the next in our best practice workflow series for NextGen Population Health Solutions. This one is using the ACG risk score and the HCC score together to improve your bottom line. Today we have the usual presentation team, which is myself, Dr. Jen Bolduc, VP of Population Health, and Brian Sauer, Senior Product Manager. We're going to jump right into the situation. So we learned this best practice workflow from one of our clients who went to a pre-visit planning and was able to identify coding opportunities using a combination of the ACG risk score and the HCC risk score. And so we have now drilled down to Dr. Jeff's practice. We have identified patients who are coming in to see him and then risk stratified or stratified the list by ACG risk score. So we've got our top risk score here of 4 in this population, and then we've compared it to the HCC risk score right next to it. We're going to filter this list and select those patients who have the higher ACG risk scores and the lower HCC risk scores. So anything with a ACG risk score above 3, so we're getting those patients who have a risk score of 4, and then the HCC risk score of less than 1. So you'll see Catherine, Justin, John, and Anna have been selected as having potential for coding opportunities. From here, we export the list so that we can take action on it in the EHR. From there, we'll let Brian take over.
Great, thanks, Dr. Jen. So again, inside the NextGen EHR, so pretend I'm a nurse, a doctor, care manager, whoever, I can come in and grab that list under integration utility, which we call the hub. So I can then go ahead and import that list, and then I can see those 4 selected patients here. So if we want to let the people, like the nurse or the doctor is, when the patient comes in to treat the patient, we can then go ahead and put a chart alert on all those patients' charts. So I can come down here and I can go ahead and put in a message here to let them know to check on HCC coding. So when I save it, next time they're in, it'll pop up and present to the caregiver to let them know to check the HCC coding opportunities.
Exactly. It just gives a sense of whether there's an opportunity there. It doesn't tell you exactly what that is, but it tells you that there's a mismatch, right? With the Johns Hopkins risk score is saying, this patient's at high risk, but your HCC score isn't reflecting that. And that's why the difference there indicates a potential for improved coding, which will be important in many kinds of value-based contract programs. So that is what we wanted to show you today to help you improve your bottom line using ACG risk scores and HCC scores. Thank you.